Now to a CBS News investigation of the country's largest online mental health provider. Cerebral offers prescriptions and therapy for conditions like ADHD and depression. It started just 2 years ago and grew rapidly during the pandemic. Now the Justice Department is looking at Cerebral's prescribing practices. In an exclusive interview, CEO Dr. David Moe told our consumer investigative correspondent Anna Werner that Cerebral is cooperating with the DOJ, and he's confident that the investigation will find no problems. Former patients and employees of the company told Anna other concerns. Good morning.
Good morning, Nate. The CEO says Cerebral has saved lives, but our investigation raises questions about how the company treats patients, some of whom told us Cerebral failed them when they were in desperate need of care.
Every single night I want to go to bed, just tomorrow I'm going to do it. I'm going to be better tomorrow.
28-year-old Rachel Coster developed severe anxiety after the birth of her second child.
And then I wake up and I'm home with the kids by myself, and it's just overwhelming.
Then earlier this year, she saw ads on social media like these.
Stigmas and anxiety sometimes prevent people from seeking help.
They were for a company called Cerebral that offers affordable mental health care services online. Coster signed up, met with her prescriber online, and got a prescription all in a single day. But after that,
every time I needed her help, she was never available.
Like when Coster needed instructions from her prescriber on how to safely switch to the new medication they gave her.
I didn't know what I was supposed to do.
She followed up again and again. 6 days later, and still no answer, Coster started the new drug. Then later, she broke out in a rash, a potential side effect for which the drug's maker says patients should call their doctor right away.
And I messaged back letting them know it was spreading and getting worse. And they said that they were still trying to get a hold of that prescriber.
She finally went to the emergency room where doctors treated her with IV steroids and told her to stop taking the medication. She then canceled her Cerebral membership.
They make it seem like they want to help, and then they get you, and they're gone.
Coster is one of over a dozen patients who told CBS News they had problems with Cerebral's quality of care. Dr. David Moe is Cerebral's former chief medical officer and new CEO. He says their system works.
And if you look at our outcomes, and this is what's most important, do the patients get better? They do. They absolutely do.
But documents obtained by CBS News show Cerebral leadership was informed about risks the company was facing, including patient and clinical safety issues, hires who may not meet our hiring standards, and staff practicing with expired or suspended licenses. Many customers complained that they, like Coster, couldn't reach their prescribers, to which Dr. Moe responds.
The average wait time to get to a prescriber is days. And that's, I think, what matters the most.
Yet this internal log we obtained shows the company's own staffers flagged nearly 1,200 instances of prescribers being unresponsive over the past 11 months.
Wouldn't it be dangerous if patients cannot get hold of their prescribers and therefore can't get their medications or they're not using them correctly?
So I will say we'll definitely take a look into this, and we're very serious about continuous improvement here.
But it's not just patients complaining.
It's like a fast food restaurant. Get as many people in as fast as you can.
Melissa Butoric worked as a client coach for Cerebral. A particular area of concern for her, suicidal patients.
Do you feel like clients who come to Cerebral who are suicidal are in safe hands?
No. Without a doubt, no.
For example, she points to the company's handling of suicidal clients through the messaging app called Slack. Dr. Moe says the system allows staff to quickly respond to suicidal patients.
And within minutes, a crisis specialist would help triage this patient to the most appropriate level of care.
But one staffer messaged about not getting a response from the crisis team. Another wrote that a suicidal patient had written into chat last week and no one had written back.
It's chaotic, it's confusing. It could be extremely dangerous, right? If somebody misses a message or doesn't follow it.
The words she said were exactly, hey, I'm going to kill myself.
This former Cerebral phone coordinator, who didn't want to show his face because he fears reprisal, told us he handled calls from suicidal patients despite having minimal training.
I'm not trained. I don't want to say the wrong thing. And I didn't want that on my conscience, let alone anybody to die because of something I said wrong.
I would have to review this case. What I will say is this. we've invested a lot of resources, and for the most part, as you can tell by our aggregate numbers, we're able to save lives. You have to take this in aggregate, and where many of our patients do really well. If you look at our ratings,
but these
really
people
high.
aren't living in aggregate, right? You're talking about individual lives here.
I would hope that, so I refer my close friends, my family members to use Cerebral. Our commitment here is the quality of care, and now that I'm CEO, we're going to double down and triple down on that thesis.
Now, after our interview referring to the internal logging of prescription issues, Cerebral told us that shows the safety checks and balances the company has in place. The company also says that it has reduced suicidal thinking in 50% of patients that it studied in their own study. Also, after our interview, the company apologized to Rachel Koster, saying its clinician did not follow their procedures and is no longer working with Cerebral. And if you have a mental health story to share with us, please send me an email, wernera@cbsnews.com, last name, first initial. But that's some of the concerns we're hearing from patients, former employees, former patients.
You know, I give the CEO, though, credit for speaking to you, because a lot of people in this situation are doing the jiu-jitsu move and, you know, turning into Teenage Mutant Ninja Turtles, not wanting to talk to you. Yeah. So the fact that he did sit down with you, I give him a lot, but there's still so many questions and troubling.
That there are some flaws.
Yes. It's still troubling, though.
They've said there are some issues that they are working on. He has said very clearly that he is dedicated to working on them and that he prioritizes quality of care above all else.
Well, he has work to do.
Terrific work, Anna. Great stories. Thank you.
Yeah. Thank you very much.